Alright, so I'm here to talk about my dialysis and CKD, which is chronic kidney disease. I have been doing dialysis now for about a month, and things have not gone great. I have had some serious issues with it. I had serious cramping in my legs because they were pulling too much fluid, and I have had the severe dizziness, the headaches, not being able to get out of the chair for about an hour and a half after I'm done. I will show you what my leg looks like. This is from, I got my dog here. That's from the leg cramping. If you can see. The nurse at the clinic now is trying to just clean my blood. She is no longer pulling any fluid off. They haven't pulled fluid off now in 2 weeks. Before that, when they were pulling fluid off and they were pulling too much fluid out of me, I got so depressed and so sick that I skipped 8 treatments. I didn't even know if I wanted to go back. The leg cramping and not being able to stand up for an hour and a half after I was done with a 4-hour treatment was just really mentally rough for me. I felt like I was never going to get out of there, and I felt like I was dying at all times, and the nausea was horrible, and I think the nurse knew that I was probably a flight risk, so she told me she wasn't going to pull fluid off me for right now until I got used to it, and then maybe she was going to do it slowly. So for the past, I want to say 2 weeks, 3 weeks, all she's been doing is just cleaning my blood. And, you know, I've been leaving at exactly the same weight that I've been entering. So, you know, my dry weight has been staying the same. And I'm not going to say it's great, but it's definitely an improvement. My nausea has gone away, so that's a huge improvement. The headaches are horrible, though. I still get the dizziness and the headaches, but I'm able to stand up after treatment. I can get up and I can walk out of the clinic, which is a big improvement. Before, they were having to push me out in a wheelchair. I wasn't even able to stand. They're having a real tough time with my blood pressure, which I've always had a tough time with my blood pressure. It wants to be high for the last hour of treatment, even though they're giving me blood pressure medicine. It's the last time I went in there, it was 230 over 139. So it's really, really high, and they're thinking that my migraines that I'm having is probably because of my blood pressure. However, I'm not going to say that that's not true, but I have these high blood pressures even at home on non-dialysis days, and I don't get that kind of a severe migraine when I'm at home and I have that kind of a high blood pressure. So I'm not convinced that it's still not the dialysis that is affecting me. I am still peeing on my own, which is a good thing. My potassium level is good. My creatinine is 6.5. And my GFR is down to 4%. I'm having issues with my port, and I will show you that. I've got a tunnel port in my chest, and I've had that for, I want to say, about 2 months now. I got that under emergency situation while I was in the hospital, and they've been using this bandage on me, and I seem to be allergic to all the bandages they want to put on me, to the point where it's so itchy, it's causing me to just scratch it constantly. I mean, I'm finding even when I'm sleeping, I'm scratching at it. I'm trying to leave it alone mentally, and if I'm awake, I'm able, for the most part, to ignore it, but when I'm sleeping, I wake up catching myself scratching it, and I'm always afraid I'm going to injure the actual port itself, so that worries me. And I'll show you what I did, if I can turn this camera just a little bit. I don't know if I can get the glare off this camera here. I've got this bandage on it that they've put on it. I'm getting this horrible glare. You see, there we go. Alright. So there's my port. These are all taped up. This is where they attach for dialysis, is down here. And I seem to be really allergic to this part here, the sticky part. They try and cover it with gauze as much as possible. So the less sticky part that touches me, the better off I am. But what I have done is I've unstuck the sticky part, so it just kind of sits on me and it's not sticky anymore, except down here at the bottom. It's still attached. And if you look and see what it's done to my skin, you can see these red bumps that I have. I don't know if it's in focus or not. Hopefully it is. But you can see this. These are almost scabby. And oh, they itch so bad. And this is all red. And here's my port. I still have stitches in here. And I just leave that on there like that. And then my shirt kind of holds it in place for the most part. But it makes it to where this, maybe I won't break out as bad. And I just started doing that today and it's made a huge improvement. I'm still red, but I'm definitely not as red with that not being stuck to me. So, I'm going to treatment 3 days a week, 4 hours at a time. And my days are Tuesdays, Thursdays, and Saturdays. And it's rough. I used to be on hospice. I was on hospice for about 6 months. And a part of me actually thinks about going back to hospice. I know that this dialysis is not a cure for me, and I'm not so sure I want to live longer this way. I know a lot of people seem to do really well on dialysis, and I don't seem to be one of them. So it's something I'm going to have to feel out and try to adjust and take day by day. I mean, I may change my mind in, 2 weeks, 3 weeks, 6 months from now and decide I just want to go back on hospice and not do this anymore, and that's perfectly okay. Anybody out there that is doing dialysis, whether it's for 1 week or 20 years, it's a personal decision for each individual person. Whether they want to quit, I don't want to use the word quit, that's not the right word. Whether they want to live their life a different way. It's definitely not quitting going on hospice. That's absolutely not the right word. I think anybody that deals with this, whether you're on hospice or on dialysis, is absolutely a very strong person. You have to deal with it no matter which way you go. You have to deal with the symptoms. You have to deal with the pain. You have to deal with the mental anguish, and it's not easy no matter which way you go. And I think it's just, like I said, it's a personal decision, and it's for that one individual, and I think whomever chooses that, their family and friends should absolutely stand beside them and support them, and just stand beside them. Walk with them on this journey, whether it's a couple of days is all they have, or 40 years from now. It's definitely not an easy journey having kidney disease. It's extremely mentally anguished to have kidney disease. I am dealing with depression, which I think anybody with chronic kidney disease deals with, and I think I will have to deal with whatever comes my way down the road, and deal with it as it comes, and make decisions for myself day by day. I am still chugging along and hitting the dialysis clinic, but do I see myself going 5 years from now? I don't know. I can't say that I see myself sitting in that chair for 5 years from now. I still can't say that dialysis is for me. I'm still doing it, but I really don't see myself sticking with it for much longer, unless a lot of things improve on how I feel. I just don't like how I feel on dialysis right now. But I haven't given up. So, we'll see how it goes and see where I am next week and the week after that. And every day brings something new and something different. So we'll see. And I would like to take you guys on this journey with me and answer some of your questions or some of your concerns. And maybe some of you are going through the same thing. And we can try and kind of go through this together. And I appreciate y'all being here for me. So I guess that's it for now, and I will try and take you with me on one of my dialysis trips and let you see what all they do. And I think they are trying to schedule me to put in either a peritoneal dialysis catheter or a fistula. So we'll see how that goes. With me having this serious allergy going on with this bandaging, I don't know about the peritoneal dialysis. I don't even know if I would qualify. I don't know if they have to put bandaging on the stomach with a peritoneal one. If they have to do that, they may tell me it's not going to work because they can't find any bandagings that I'm not allergic to. So I may not have a choice but to do the fistula, which really worries me because I don't want to say I'm a wimp, but I tend to cry even when I get an IV put in. I don't like pain. I don't do well with pain. And when I was in the hospital a month ago, they had to redo my IV twice, and I just broke down crying. I tend to be a hard stick, and I don't do well with them fishing around in there and trying to find things. And I have heard that the needles that go in the fistula really hurt. I heard that they're pretty big, and that it's pretty painful. So it's got me nervous, it's got me worried, and it would be a huge factor and me deciding whether I want to quit dialysis or not, and that's got me concerned also, and it's got my family concerned, which is why we were kind of leaning towards a peritoneal dialysis. But again, if the peritoneal dialysis, if you have to have a bandage on it, I can't live with this itching and breaking out constantly. I can't do that, whether it's on my chest or my stomach. It's not going to make it any better. So I don't know what I'm going to do. We've got some big decisions to make that are coming up, and some roadblocks to conquer, and I don't know what's going to happen. But I will take you on this journey with me, and we'll see what happens. And I appreciate you guys standing beside me and supporting me, and I will let you know what happens. And I will talk to you hopefully next week. Maybe I'll even take you along on my next dialysis treatment and let you see what's going on. All right? Bye for now.